Hello, everybody. This is Dr. Kamel again, and one of the new concepts and new videos related to physical therapy license exam preparations. If you didn't see any of my videos before, my name is Dr. Kamel. I work as Associate Professor of Physical Therapy in the United States, and I am a registered licensed physical therapist in a number of states across the USA. Also, I am a registered licensed physical therapist in the UK and Egypt. I have got my PhD from University of Nottingham in the UK. So let's go to today's content. A 70-year-old patient with a history of rheumatoid arthritis reports stiffness and pain in both hands and that limit the ability to perform therapeutic hand exercises. We know that rheumatoid arthritis is one of the systemic arthritis affecting several systems in the body, including the small joints of the hands, and we talked about rheumatoid arthritis before. So the physical therapist plans to apply a modality prior to exercise to decrease pain and increase extensibility in the hand joints. So what is the aim of applying this modality? Reduce pain and increase tissue extensibility in the hand joints. Which of the following modalities is most appropriate to achieve this goal? Number one, cold gel back. Number two, or B, direct contact ultrasound. C, continuous short wave diathermy. D, paraffin wax bath. And what is the correct answer? It is D, paraffin wax bath. Let's explain why this is a correct answer. A paraffin wax bath will provide superficial moist heat, and this is what we need actually. That is particularly effective for these small joints of the hands and feet, which is affected by rheumatoid arthritis. It is commonly used for patients with rheumatoid arthritis or osteoarthritis. Okay. Why? What are the indications or the goals behind using paraffin wax on these joints? Number one, to decrease joint pain. Two, to reduce stiffness. Three, to increase tissue extensibility. This is what was mentioned in this stem. Four, prepare the hand for stretching and active exercise. Okay, but when, if there is no flare, because we know that rheumatoid arthritis patients, they get flares from some time to another with increased inflammation, pain, redness, and stuff. So we cannot do that while flare is there. This paraffin wax, we is warmed typically at a temperature of 47 to 54 degrees Celsius or 116 to 129 Fahrenheit, and it will coat the hand and delivers uniform heat. This is very important. It is uniform heat across, the whole hand, and especially for the distal parts of the body, like hand and wrist, like ankle and foot. This is important, which helps improve joint mobility before exercise. Okay. So this modality widely recommended in rheumatoid arthritis management prior to any therapeutic hand exercise. So again, we can use only paraffin wax when there is no flare, non-flare phases. And we know the aims now: decrease pain and increase tissue extensibility and so on. Why? Because there will be some increase in collagen extensibility associated with heating, which might reduce pain perception and also increase the tolerance for and participate and for pain and participation in active exercise, ability to participate in exercise. Okay, so this is the answer. Let's look at the incorrect answers. Cold gel back. Cold therapy actually will decrease inflammation. We know that, but usually with acute inflammation, so it will reduce inflammation and pain, but at the same time will reduce tissue extensibility, and this is not required here. okay, and at the same time might increase joint stiffness. So if we are using this modality before exercise in rheumatoid arthritis, is not recommended. Okay, so again, cryotherapy, cold gel bags decrease tissue extensibility, and this is not required. B, direct contact ultrasound. Ultrasound can produce deep heating, okay, but it is less practical actually if we apply it in treatment of multiple small joint, like we talk about here, the interphalangeal joint, metacarpophalangeal joint of the hand and wrist. This is hard. Okay, so but paraffin, again, paraffin wax will lead to uniform management or across these joints. Continuous shortwave diathermy. I don't see anybody now using shortwave diathermy, but we need to learn about it. It will provide deep heating again, but it is not typically used for small distal joints like the hands. Okay, so it is less practical. So these modalities actually, like these two modalities, is not easily applied over thin soft tissues like the hands and fingers. But paraffin can allow even distribution of heat to fingers in all joints. So again, for hand arthritis patients, classic pre-exercise modality is paraffin wax, and then stretching, active range of motion, strengthening exercise. This sequence will help maximize mobility and reduce pain during exercise. This was the answer for today's question. If you would like to join my PT license exam preparation course, please drop me a message on WhatsApp number 00144224872006, 00201027743702. If you would like to apply and join the post-professional degree of DBT or transitional DBT at University of Montana in the US, which is online program of studying with a discounted rate, you can also send me a message on these WhatsApp numbers, and I will send you the details. One more thing, I am thankful for you who are watching me, who are following my channel. So if you kindly can share that with your colleagues, and if you can subscribe to the channel so you can receive any new updates of videos and content, will be much appreciated. Thank you, and see you soon in a new content.